this segment's going to focus on regenerative medicine of the pelvis. The pelvis, as you know, is a very large area and a lot of things attached there. It probably has the greatest collection of nerves in your body. It certainly has the largest reservoir of blood in your body. It is where you really stabilize yourself. If you were ever into martial arts or Eastern medicine, you probably know that your center of your body is not here. To them, it's down here in your pelvis, because it really does provide a lot of your stability. There are a lot of things you can hit and fix in terms of things that ail you with regenerative medicine in your pelvis. A real common area where people get pain is what's called the SI, or the sacroiliac joint. If you can look right behind me here and see this model, that's your SI joint right there. It's where your pelvis and your tailbone kind of meet. It looks like the wings, where the wings in the body of a butterfly meet. That's a joint that's held together by a very thick ligament, and a lot of people who come in for low back pain are actually referring to their SI joint. They have pain when they sit down. They'll feel a clicking or a movement. You push them just below their back over their buttock, and they want to jump because it hurts so much. Well, that's a ligament that doesn't move much, but when it has a little extra give in it, and cause a lot of pain. And that tends to respond typically very well to regenerative medicine, because it's a relatively stable ligament to begin with. So a couple injections, usually with the appropriate amount of rest and nutrition, they tend to do well. When it comes to the anterior pelvis, again, a lot of things attach here. There are a lot of muscles like they call the adductor muscles of your hips, the muscles that bring your legs in. When people get a groin pull, or even an abdominal strain or a hernia, these are all defects in the soft tissue here. If you've had a condition called a sports hernia or a Gilmore groin, they're very debilitating. Baseball players, hockey players, soccer players get these. They'll get a groin pull kind of in there, and it's one of those that often just does not go away. They'll stay off it for 2-3 months. They'll do months of rehab. They'll feel good. They'll get back on the soccer field, and they'll kick once across their body, and boom, it goes right back. It's very frustrating. Well, what you're dealing with, the damage to soft tissue. So regenerative medicine is very good for that, because there's not a really great operative technique to fix that. You can't staple that stuff down. So by hitting some of the attachment points, particularly the ligaments along the top of the pelvis here near the pubic bone, people tend to respond very well. So the most important part about doing damage or regenerative medicine to the pelvis is addressing where the problem is and doing a thorough history and examination. That'll probably pinpoint the source of your problem. Once you've got that, you know where to direct the regenerative medicine, how to heal the person.